Hello there, Dr. Miller here with a book review. One of my favorite books. There's a new edition, well, new-ish edition that was released. I thought I'd share it with you. Make this a shorter video, hopefully, fingers crossed. But the book is called, I'm going to jump right into it, by the way. So subscribe to my channel. You know the Lambo pursuit we're on because we're in it together. Sorry for the dinger. Notification bell. Should have timed that a little better. Somebody emailed me a little bit later. It would have been perfect timing. And you see if you like this video first before subscribing or liking the video, of course. But I hope you subscribe. There's more book reviews in this one. I can't remember what number on. I'll put it in the description of the video. I forgot to look before I filmed. I was just so excited to talk about this book. Okay. This book is Anatomy Trains by Thomas Myers. Okay. And some of you may have heard this book. Some of you may haven't. Dr. Myers. Thomas Myers is a massage therapist. Have you ever seen some of his videos? He's a strange feller, but anybody that plays with, plays the wrong word. Anybody that deals with cadavers on a regular basis and seems to really enjoy it probably is a little bit awful to some degree, but his Anatomy Trains book, the first version came out. It was kind of like one of those like wow books, like a lot of this is, what we see in human movement really did a good job of pulling all together. So let me just start off with this to begin. This book I would recommend for everybody. If you're not familiar with it, I would purchase it. You can get an older version, perhaps. Still, I think I'm trying to remember the first version. This is the fourth version. The pictures, the diagrams, examples provided are fantastic. Okay, and I'll talk about what's so fantastic. But I'm just saying the presentation of this book is really well done. It is a nice book. It's well written. It's kind of got witty parts and as witty as you can be when you're talking about these, subjects. But the premise of the book now, so that's the book in general. I won't show a picture of it. I guess I can, but I'll put obviously a link to it in the description as well. Okay, Anatomy Trains is the latest one. I'll give you maybe just a quick glimpse of some of the pictures in here. There are cadaver pictures in here, so maybe if you're not a big fan of cadavers, don't eat your lunch before you have. I'm not going to show you a cadaver picture, don't worry. But it's a very well done book. It is a textbook feel, but it's a heavy, meaty book. It's a heady book, but it's for anybody that's interested in movement. Certainly, if you are a movement professional, personal trainer, strength coach, sports coach, I would read this book. Okay, and you're going to want to read it, and you portion it out, and it's not a book you just kind of blow through. It's not like a novel or something. It does have that textbook feel. It's some heady stuff in there that you have to sit down and think about. But if you absorb a lot of this information in the book, you will be better off in understanding human movement. The reason is the book really, just the name implies, it talks about these different anatomy trains, these different trains that Myers has seen in movement. He uses examples of movement, but also is dissected in dissections, has demonstrated these trains. And he's got, some different vernacular he used, like the train type of lingo, right? Derailments and, train stations, kind of the junctions, right, that are occurring. But the premise is that unlike a typical anatomy book where muscles are cartoons drawn independently of one another, and that's how you learn anatomy initially, right? Here's the quadriceps muscle group, and here's the four muscles involved, that are part of it. Here's the hamstrings, and here's their origin and insertion, and so forth. This book, though, the body doesn't. By the way, back up. Body doesn't work that way, right? And this is where we get issues, especially in sports, and it's gotten better in terms of rehab and things like that. But when we try to isolate things in just general movement, whether that's sports or regular movement, to say I'm just going to work on this muscle group. Well, you're essentially I'm going to take his Anatomy Trains kind of example here. That'd be like really bolstering one of the cars in a train, right? Well, if one of the other cars is really weak, or the thing that's attached to that really strong train isn't very strong, like trains are hooked together, right? It's not very strong, then it could break. Okay, so understanding that muscles are just thickened portions of tissue. Obviously, they're different types of tissue, but they're different. They're thick. They're thick. They're different thicknesses. They're different tissue, but they're in this anatomy train, right? And the next one might be a tendon, and the next one might be a bone. The next one, will be some ligamentous tissue over the bone that's attaching the next structure to that. There's a linkage. There's the one train that I always think of, superficial backline, is, like from the scalp, right, all the way down to the plantar fascia is one continuous piece of tissue, really. Now, it may be hamstring muscles at some points, tendons at some, muscular tendon units at some points, ligamentous tissue at some points, but aponeuroses at some points, which is ligamentous tissue. The point is it's all attached. And so when you start to think about how does this impact human movement and how people move better and how people train, especially, again, we're talking about athletics. I'm not necessarily thinking about physique per se, because physique, you might be trying to really focus on one rail car, right? That was a train car, a rail car. You might want to focus on one rail car. You really need to get your, your delts up. And so you're going to push hard for that rail car, okay? And you're not really concerned with how that's affecting the other rail cars, other than that you want all of them to look the same and proportionate or whatever. Or you want all the rail cars bigger. But you're not really thinking about the movement. When we apply this book, though, to moving better and athletes and things like that, I mean, it's gold, Jerry. It's gold, okay? And so the book goes through all the different anatomy train lines. And again, I think you think critically about this. I think, the derailments, like there's tissue and then the tissue stops and then moves over, like you might see in the anterior line. Like the quadriceps, and then you move over to rectus femoris, and the idea is there's a derailment there. There's not a continuous tissue piece, but it's transferred through the pubis region, right? So, some people are like, well, I don't know by that, I thought it was, but you might run into things where you have to think a little bit. And I think that even if you disagree with some of the things that Myers puts forth in this book, it's going to at least help you to think a little bit more about anatomy. I think my experience as an educator is we don't know, like when I send students out, the one thing that they lack the most many times is anatomy knowledge. I mean, if you think about what a physical therapist and a chiropractor really, they're just and massage therapists are anatomy experts. That's how they know how the body moves so well, is they appreciate fully the connection between all the anatomical pieces. I mean, especially when we're talking about the anatomical pieces related to locomotion, related to movement in general. Okay. So anyway, here's some of the different. Well, the book starts out with just kind of establishing some of these definitions, like, right, what is a derailment, for instance, main lines, and right, he defines all these different categories. When you're looking at the line, understand where there's a lot of movement and not a lot of movement, or where there's rotation occurring. He again uses the train analogy throughout, which I think is pretty solid. Again, he calls this the rules of the road. And then we get in the superficial back line, the superficial front line, the lateral line, the spiral line, arm lines, and then the functional lines. You kind of pull the different ones together, and then deep front line, and then some movement examples. Okay, and then there's some appendices, some really interesting appendices on fascia and was that where the postural stuff was, or was that the one before? I think that was in the movement section, but some really good examples about how to evaluate posture. Like, if you're a trainer or working with somebody, you can look at their posture and already start to think about some of these anatomy trains, right? Already start to think about some of the tissues that may need adjusted, and maybe why some tissues are stressed down the train from this other side. I'll use like head forward position. How is that going to affect even some of the anatomy of the lower body? Or is it, right? I mean, these are things that you start to put together, all the pieces, instead of having these discrete pieces, discrete rail cars out in the middle, never floating. You start to look at how the train moves together. I talked about the joint by joint approach, and I think he has some pictures in here too as well. He actually takes a little bit further than I did in my video, which is spot on what he said. And I can add those too. But just understanding the joint by joint kind of idea, and then the different curves, both secondary and primary curves, like curves we're born with, right, versus curves that are established over time, and how if we're not moving well, this is more like in the developmental kinesiology part where he talks about, then we're going to have some of these curves that are malformed and not fully formed, and so for example, like your sacral curve, right, the actual curve of the sacrum is a primary line, but your lordotic curve of your lower back is secondary. So that's an extreme example. Somebody never walks, right? Let's say they could, but they choose not to. The lower back for that individual is going to be straight, right? You're not going to get that curve. What creates that secondary curve is walking. And some of it's gravity and some of it's the hip flexors pulling on that lumbar area, the lumbar region, because the hip flexor muscles, the psoas muscles, major and minor, are attached T12 down. So you're going to get some anterior movement just by lifting your leg up into hip flexion. And so that creates the curve. But if you don't ever use that, right, you're not going to create that curve. Crawling, right, and creating that gravity pull, okay, it creates that secondary curve. Okay. So the whole point is that it's looking at the body, I think, in a lens that makes a lot of sense. I'm not like, I don't walk around thinking about all the lines specifically, specifically, or no, lines is the appropriate word there. Lines specifically all the time. But by reading through this book, I understand a lot more about what I'm seeing in somebody moving or not moving well. Like where could there be some problems in that particular line, like the deep, superficial back line or whatever it is, right? Where is that, or the spiral line or whatever, where is that, that issue occurring in that line that's causing this movement malady, that's causing the movement not to be done well. Okay, so that's something to think about. I think a book that would be worth your time to think about moving better, especially if you're a professional in the field. If you're just somebody who likes to train, obviously it's a great book, and I think you pick it up and start getting into it. I don't think you need a bachelor's degree in biology or exercise science to pick it up and read it. It would help, but you're probably going to have to slow down a little bit more as you read through it, but you're still going to get quite a bit out of it. Again, there's cadaver pictures in here, so sensitivity alert. If you're sensitive to cadaver pictures, you may not like it, but the cadaver pictures are very helpful in giving credence to what Myers is showing you with these lines, and really providing so again, a lot of times we assume when we see these cartoony basic anatomy pictures is how things are, but when you actually look at the human body's structure, you start to see more of the completeness of it and the intricacies of it. How the tissues form almost like a like a heel cradle, right, for the foot, rather than just this Achilles tendon or a calcaneal tendon and then the plantar fascia. Like, look at the whole tissue together, and you start to understand things like plantar fasciitis a little bit more, for example, and how the connection between the calf musculature. Okay? So that's one example. So again, I'll leave it there, but highly recommend this book. If you're a professional, you should have it on your shelf. Again, you have to, believe everything he's saying if you don't like it, but you're gonna find a lot of nuggets in this, even if you're like already, for some reason, you're like, I don't think so. It's a great book, 100%. It's next to the Nyman book I think I reviewed earlier on. This is one of my favorite anatomy books, by far. Okay, I'll leave it there. Like I said, I'd leave it there already, so I'm gonna do it this time, and I'll see you guys in the next video.